Pete.
Good evening, good evening, good
Yeah.
evening, and welcome to Couch Conversations with the Doctors, where health is wealth. What night is it tonight? It is Monday night, and it is time for Couch Conversations with the Doctors. I'm having a few technical difficulties, so one of our co-hosts is going to take over for me, and that's Dr. P, while we get everything settled. Pete, if you can hear me, take it away.
Hey, Nikki, thanks so much. Guys, we're excited tonight to have our colleagues on. We're going to talk about some health topics that's very important for the community. And we're going to start off with some introductions. And first, we're going to introduce the one and only, the professor from the Department of Public Health. We want to introduce Mr. Joe Harrington. Joe?
Thank you very much, Pete. I am no professor, but I did work in public health and healthcare. Retired in 2017 from the Illinois Department of Public Health, where I was the regional health officer for Cook County as well as an administrative law judge. Prior to that, I worked for the city as an assistant commissioner and worked at 3 hospitals. I'm excited to be here and look forward to trying to answer some questions and having a great conversation about how people can stay healthy.
Joe, that's awesome. Thanks so much. I appreciate it. But you are a professor in our book, so that's all that counts, and the community thinks so. Okay. Now, we want to introduce Dr. James Miller, internal medicine extraordinaire. Dr. Miller, we want to introduce yourself.
Yeah, good evening. My name is James Miller. I am a retired internist, practiced about 40 some years, um, all around Chicago, but mostly west side and west suburban areas. Always been interested in healing by prevention and by uh, giving people, empowering my patient as best as I can, because I understand the a patient with knowledge is in a much better situation to be able to help themselves than one that doesn't have that knowledge. So, and that's our purpose for this forum, is to inform the community and to help to empower the community so that we can have a healthier community. It's all about healing. And so, we're still in the healing business, even though I don't practice medicine. I'm still trying to heal. So that's who I am.
Absolutely. Thank you so much, Dr. Miller. You're right. This is all about healing, and so is this panel and this platform. And now, moving with the internal medicine extraordinaire and rheumatologist, Dr. Douglas Graham.
Thank you, Dr. Pete. I'm also a retired physician. I worked in the western suburbs for about 30 years and then joined the congressman in his office for COVID, the impeachments, and the insurrection. It was an eye-opening experience. It really made me interested in pivoting to public health. So it's a real honor to be here to work with my colleagues. And I'm going to try and answer your questions as best I can.
Awesome. Thanks so much, Dr. Graham. And then to my lion brother, fellow alpha brother. And so, by the way, Joe's a fellow alpha brother as well.
As well as the congressman.
As well as the congressman. I hadn't gotten there yet. But, it's great to be amongst great men. And we want to introduce the metabolic doc, obesity doc. I refer patients to him who are having trouble getting their glucose controlled and diabetes controlled. We have Dr. Tony Hampton.
Thank you, my brother. And we missed you. We had a gathering recently, and you had to take care of those beautiful daughters, which is always the priority over the brothers, even though, some alphas don't believe that, but family first, right? And then the second family are our alpha brothers and other fraternity members who we all love. Family doctor, obesity doctor on the south side of Chicago, all about doing exactly what Dr. Miller said, which is, even in retirement, you can help people heal. In fact, you may reach as many or more people using platforms like this. So I think we will probably do this work until we're not breathing. And I really feel privileged to do it. And there's so many people who are looking for hope, and that's what we're here to bring. So let's bring it on.
Thank you so much, Dr. Hampton. I tell you, I learned so much from you. I preach to my patients about the dangers of sugar and how insulin is not your friend. And so I learned so much from you. And I appreciate you sharing that with the community. I share with my patients as well. And then now I would like to introduce our guest, Mrs. High. Would you like to introduce yourself and where are you from?
Sure, and thank you. I am so technologically inept. We thought we'd get better during the pandemic, and no, I'm going to be the dinosaur I am. My name is Laura Jane Hyde, and I am honored to be the CEO of Gilda's Club Chicago, which I know some of you know about us. We are a cancer support community for anyone impacted by any type of cancer, caregivers, work colleagues, members of the faith community, participants in schools. Our deep belief, which was obviously heightened during the pandemic, is that people do need to be in communities of support. And so, Congressman Davis, thank you so much for the invitation to join you all this evening. And again, I apologize for my IT uh, deficiency.
It's no problem, and you did a great job. Thank you so much for being here. We're looking forward to hearing from you during this panel and sharing with our community as well. And now we have our Congressman of the 7th Congressional District. We are so happy to see you. And would you like to share some words with us? This is the platform that you and Nikki created. We're so proud to be a part of this.
Well, thank you all very much. As a matter of fact, I am excited and delighted. And Joe, I was also told that when you feel good, that's a state of desirability. And it also means that you're pretty healthy. Well, I feel good. I feel good about the environment of which we are in. I feel good because I think we have a much better chance of maintaining and promoting some of the meaningful thoughts and ideas, but also maintaining some of the progress that we have made as a country. I feel much better about the possibilities of that than I did 2 weeks ago, and that excites me. So we are now on recess for the rest of the summer, but I've got to run into DC tomorrow. I feel good because I'm going to open a discussion on child welfare at the White House tomorrow. And so I feel pretty good about that. And we welcome our guests. As all of us probably know, we interact with thousands and thousands of different kinds of people, different kinds of groups, different advocacy groups, somebody organized, because that's our country. And the way our country works is we have so many interests, so many issues. And in order to make sure that yours get to the attention of others, you have to advocate. You have to keep educating them. You have to keep making them aware. And you do it oftentimes from the bottom up, as opposed to from the top down. And oftentimes the top down does not reach nearly as many people as the bottom up. So I want to thank Ms. Laura Jane Hyde for being with us this evening. We're delighted that she's here. Enough said. Go ahead.
Okay. Is this am I supposed to speak now?
Yes, go
Okay.
right. Unless Nikki want to add some more to what your organization, well, why don't you do it yourself?
Okay.
Yeah.
So, and Dr. Harrington, it's nice to see you again. I know that you were at the club probably 20 plus years ago. So we're still plugging away. Gilda's Club Chicago opened in 1998. And from the very beginning, we had a focus on reaching anyone impacted by cancer. So we were very proud in terms of our work in the community to hire the first African American program coordinator in 2012. Before that, we hired our first Latino program coordinator in 2004. So one thing that has been very disturbing to me over the course of 27 years with the organization is that we haven't been able to really narrow the gap as much as we should in a city with our resources. And so having the program of support that we have and really expanding it into the community has helped us reach a lot more people. So we are at Mount Sinai, we're at Advocate Christ, we're at Lurie Children's, and we're at Northwestern. We're in the faith community. We go into any school that's impacted by cancer, and we also go into the workplace. And we have had the opportunity to be at the past 2 community fairs, health community resource fairs sponsored by the congressman. We will go anywhere to talk to anybody about what we do. And another piece that we bring to the table is the fact that our Cancer Support Community Headquarters organization has a research and training institute and a policy institute. And the policy institute is really one of the most important things that I'll share with you today, because we need to let all the constituents know that while this is an automatic benefit, they need to enroll. And if you're all familiar with this, please bear with me as I regurgitate information that you already know. But Part D Medicare enrollees will be able to opt into the prescription payment plan when they enroll beginning in October 15th for the open enrollment period. What this does is it caps their out-of-pocket drug costs at $2,000, and it provides for the opportunity to pay those costs with 0 interest monthly payment installments. So this is huge, because we know if you're making a choice between food and drugs, and the food is for your family and the drugs are for you, right? People are forced to make choices, and we don't want this to be a choice that they don't take advantage of. So what they need to do is make sure that when they enroll, they opt into that program. We can provide anyone on the call with flyers that you can share. We'll talk to anybody about it. We can talk people through it. I am not somebody that understands complex issues, so I just want to make it so clear about what it is that will be provided to constituents and members of the congressman's district, and just help share that word. And also make sure that everyone knows that our program is completely free. And so if there's a site that you think we should be doing programming at, if you want to come down and see the club, the only reason that we exist is to make sure that no one has to go through cancer alone.
So Laura, how do they contact you, Laura? How does someone become a part of Gilda's Club? And what are some of the services that Gilda's Club offer to those families that may have gotten that type of diagnosis? We know that diagnosis isn't easy to hear all the time.
Oh.
But there's great movement when they do hear that, because there's so many great things going on right now. So how do they become a part, and what happens?
So they can call the clubhouse. The number is 312-464-9900. And probably more important is knowing our website address, gildasclubchicago.org. The programs that we provide begin with individual counseling. So oftentimes the diagnosis of cancer, as you said, Nikki, it's always hard to hear. And sometimes somebody may be in really an acute state of distress. And so by providing people with that one-on-one time-limited counseling, that can help them take the next step, which would be to get involved with groups. We offer support groups that involve patients, caregivers, children, someone who's lost a loved one, based on the type of cancer, as very wide-ranging. We know that education is key, so we offer a number of lectures that provide information on different types of cancer and different topics that are top of mind for people. Mind, body, we know the connection between our mind and our body. Yoga, art therapy, music therapy, sound bowl relaxation. All of those things help. Social events, right? We all went through the pandemic, and being together in community, enjoying poetry reading or an art gallery or a meal with others is so key. And then resource referrals, right? So as the congressman said, he works with a number of advocacy organizations. We don't do everything. We know we don't do everything, but what we do, no one else does in the city. So we want to make sure when somebody comes to us, if they need something specific, that we're getting them plugged in. Because the hardest thing that somebody can do is reach out to us for the first time. Denial is a really, really wonderful tool. Maybe not the healthiest tool, but we all have different ways of managing stressful events. Somebody may be an information seeker, they get the diagnosis, they immediately reach out for information and resources. Sometimes it takes the patient the full year to go through the treatment, and then everybody goes, yay, you're done. And they're like, what the heck just happened to me, right? Everybody wants to move on with their lives. Sometimes at the moment of diagnosis, it's the caregiver that needs support and says, okay, my loved one has a course of treatment and they're focused on this. I'm still getting mad that they're not picking up their socks or they're leaving their dirty dishes in the sink. So again, based on 27 years of being in this work, I 100% believe that at some point, every family unit, however you define your family, someone in every family unit would benefit from contacting Gilda's Club. And so we're just scratching the surface in terms of the people that we need to reach. And that's why we have, a diverse staff. It needs to be way more diverse. We know that, but we need to be able to meet people in the communities and build trust. One of the things that we did during the pandemic, and Joe, I don't know if you remember, we had that beautiful mural of Gilda's characters when you came into the club. We heard from our members. And I mean, the more time that elapses, fewer people remember Gilda. They would come in and they'd say, but I don't see myself. And, you can only explain to people that it's Gilda's characters for so long. The problem is people form impressions. We don't always know what those impressions are in their perception. So we redid the lobby, and now we have a wall full of photos that demonstrate all the different activities, and people come in and they see faces like theirs. And that is so, so critical. So the other important thing for everyone to know is we always want to be better. We can always be better. I love constructive criticism. I would prefer that to accolades. So if there's anything that as you get to know us, hopefully, and see what we do, if there's any information that would make us a better organization, please, please, please reach out to me.
Yeah, I have a quick question.
Sure.
Jane. So based upon what I heard you say, there's no age restriction and there's no income requirement, because a lot of times people talk about programs and there's a restriction. There's age sometimes, there's income levels, but you will serve anybody that comes through around this issue of cancer.
Correct.
And provide services to them.
Yes.
So I want everybody to understand that.
Thank you. And two other important things that are tied to that. We never ask people for money. We never ask members to donate. We make it almost impossible, which is why people never believe that I actually was a fundraiser many years ago. Still am, but and we don't ask income levels, right? So we don't know what somebody's income is. The way that we are able to extrapolate data, because a lot of times, especially banks, right, they want to know the demographics. So we do get demographic information in terms of where people live. We're able to do a zip code sort against the census data and say we believe approximately a third of our members are in low to moderate income. It's not a perfect science, and then we also know that if we're at Sinai, ethnic crises, a broader range of participation, we don't want there to be any barrier to people getting the care that can be life-changing. And those are words that members use with me. I don't use those words. I am quoting members when I say that.
Yeah, I want to offer up something else, and then I'm going to let my colleagues chime in, because as you were talking, I was thinking about an issue that Cook County government has taken on, and that's medical debt. And people probably don't understand the real impact nationally of medical debt. And I've been doing some reading. I'm working with some colleagues on a project around medical debt and trying to get a better understanding of it. But I was looking at the website of Kaiser Family Foundation, and I'm just going to read this to provide a context for this issue of medical death in the United States. Despite over 90% of the United States population having some form of health insurance, medical debt remains a persistent problem. For people and families with limited assets, even a relatively small, unexpected medical expense can be unaffordable. People living with cancer, for example, have higher levels of debt than individuals who have never had cancer. High deductibles and other forms of cost sharing can contribute to individuals receiving medical bills that they are unable to pay despite being insured. According to the Kaiser Family Foundation polling, 41% of adults have healthcare debt, according to a broader definition, which includes healthcare debt on credit card or owed to family members. So cancer is a big driver of medical debt in the United States, and services like yours are really, truly needed.
Thank you. Yes, financial toxicity is a very real thing. And Dr. Harrington, if you ever would like to present to our members, we would love to have you to talk to them and explain, or whatever the forum might be.
I'd be happy to come back and talk if you don't refer to me as a doctor. If
Well,
you call me Joe or Mr. Harrington or something, I'm more than happy to reply
Yes.
to that.
Ms. Hyde, can you tell us about volunteer opportunities?
Sure.
If someone wants to volunteer, if service organization wants to partner, what does that process look like?
So the process would involve contacting our volunteer and outreach coordinator, and I can put anybody in touch with her. We have group opportunities, and we have opportunities in person at the clubhouse, and we have outreach opportunities where we would train volunteers to go into the community. We get so many requests, especially during the summertime and during specific months like October, to talk in the community, that having trained, a trained fleet of people to go out is so extraordinarily helpful.
Well, let me ask you, what can volunteers do?
So we have one Saturday a month. We're building back to the hours that we had pre-pandemic. We're very fortunate to be in the hospitals because we're seeing the numbers that we saw pre-pandemic, but getting people to come into the city is a little bit challenging. So we're bringing that back. They can come and cook a meal for members. They can put together little wellness bags that we can hand out in the community. They can make phone calls. They can help with data entry. There's a lot of different ways that people can help, and I can share the menu of opportunities, but those are just some of the broadest ways.
Well, outstanding. I want to say hey to Audrey J. Cox, who's here. She says, good evening to everyone. Jack Lynch is here, and he says, good evening to the team. And that is such a great resource. Not only did we learn about the great things that Gilda's Place have in reference to people who have received a cancer diagnosis, but we also learned about something called Cap and Smooth with Medicare, which will be helping out those people who receive Medicare. That's coming up really soon. So don't forget, October is your time to make sure that you can get that benefit. And call and make sure that benefits for you. We will have, because we've gotten a number of requests about, can we explain the Medicare process and the ABCs to Medicare again? So we'll probably be doing that end of October when that season comes around for you to choose. And then we'll make sure that everyone hears about Cap and Smooth once again. So we do not want you to forget about that at all. Not at all. Pete, can you share, or Tony or Dr. Miller, one of you all, so we do have a question that says there are so many forms of cancer. How does cancer just seem to find itself in one place, such as breast cancer or prostate cancer? When you have those, it tends to go everywhere. Was the cancer always there?
This is a perfect question for, as Dr. Pete liked to call me, a metabolic health doc, right? So. And as I share a few thoughts about this, Laura, I want to know if you've heard anything of what I'm saying, because one of the reasons why I try to speak on YouTube and elsewhere is because people just don't hear the things that I'm learning. And as I learn and grow, I want them to learn and grow. And let's be truth be told, we all have family. We all have, we all face the challenge of cancer, arguably one of the most scary diagnoses because it's a little mysterious in a lot of ways. And that's why it's still a little bit of a mystery. But what I'm going to tell you what a metabolically trained doctor thinks about when they think about cancer to kind of answer this question. Cancer has been historically thought of as a genetic disease. And just like COVID, it's challenging because there's always these mutations that drive cancer's ability to survive. So if you think about COVID, you think about, okay, we come up with a vaccine, then it mutates and mutates. Next thing you know, the vaccine's not as effective. Most mutations are not in favor of COVID. Most mutations are not in favor of cancer, but when they are, they can be deadly to the human body. So that's been the historical ideal of what cancer is, but there's emerging evidence that cancer may not be a disease of genetics, but maybe a metabolic disease. And one of the reasons why I consider myself a metabolic doc is because you address a lot of things if you are metabolically healthy, if your body is functioning properly. So what happens in a cancer situation, if you're trying to just imagine you come up with the perfect drug for the perfect cancer type, and you make that drug perfectly for yourself, and then you give it to the patient. By the time you actually develop the drug, and by the time you do all of that, the mutations could have occurred, and it's too late, and the drug won't work as well, or eventually it won't work as the mutations occur downstream. But what they're finding is that these mutations and all this genetic things, that's actually more of a downstream phenomena. That's not something that happens in the beginning. What actually leads to cancer, the new research is showing, is that it's a dysfunction of our mitochondria. Many of you guys know the mitochondria is the powerhouse of the body that makes all your energy. And there was some research done by a doctor, it was called the Darwin effect. So it was a guy who was a researcher. And what they found is that when cancer cells are growing, they go through this fermentation process that's dependent on glucose as its primary fuel, which is sugar. In fact, if you think about a person who gets a PET scan, we inject radioactive glucose into your arm. And basically, the glucose goes straight to the cancer because that's their primary fuel. Other types of fuel which will make cancer starve is like fat fuel, which are ketones, which is why a lot of people in the metabolic space are suggesting diets that reduce sugar and increase ketones as very effective. So it's really important people understand that. I've done videos on YouTube with experts like Dr. Paul Merrick to talk about this topic. But what I love about this concept, guys, is that when you have to deal with mutations, you kind of lose hope because it can happen anytime. And just when you thought you had it nicked, it comes back, and here we go, right? But when you're dealing with if the root cause of cancer is a poor metabolic health, is the poor mitochondria not working. And the solution for that is to feed the body a fuel source that's other than glucose. You can actually do something about it. So part of the treatment of cancer in terms of treatment and prevention should be to help our bodies not rely on glucose so much. So that research is ongoing. There are other experts out there who are doing this work. But to me, as the work of Laura is doing, it provides hope, because if you can actually walk into an encounter with a person who's suffering, you can say, these are the things you can do. For example, Dr. Paul Merrick and his team came up with what are the supplements you should take to prevent cancer? Off the top of my head, it would be vitamin D, omega-3, melatonin, even metformin. Even though I'm not a big fan of medicines in general, metformin has been shown to reduce be preventive. Those are some ideas. And then there's other things you would take if you're trying to actually treat cancer. So my whole point of bringing this up is to say, this is the most important message. If all cancers all cancers have mitochondrial dysfunction as a common element. All cancers don't have mutations and genetic abnormalities as a common. So that by definition means that can't be the cause of cancer. It can be a factor, but it can't be the cause. So what that means is if I want to have a healthy mitochondria, I have to start eating in a way that reduces the glucose burden. But guess what? It's not just your diet. What else raises your blood sugar? Stress, lack of sleep, being in a dysfunctional relationship. So all of these things that we do in life, that's why any cancer treatment in the world or in the country should be holistic in that it deals with nutrition and exercise and sleep and a sense of community and support and all the things that you need to do. And if you do all of those things, I can't tell you what ingredient in the soup is going to be the most effective for you, but I guarantee if you have a soup in front of you with different ingredients, you're going to do better. And again, that provides, so we need support from Laura and her team. We need doctors and other clinicians understanding the importance of metabolic health. And if we put all of that together and wrap it up in a bow, people who otherwise would have died maybe a year ago because they had metastatic disease, maybe here 5, 6, 7 years later, and they may still succumb to it. But what will happen is they're creating a body that's not a good place for cancer to live. So the cancer is going to be kind of not going to be able to progress. So it's good for prevention. And it's good as well for treatment. And I'm really excited about that. So if anybody, I'm not logged in, but I'll try to go to the YouTube channel for the broadcast and put the links to some of those videos so people can then get more information and then share that with their families.
And we'd
I'd like to, if I could, and this would be brief. Dr. Mason, who I worked with for a number of years, still good friends with, and who's not with us tonight, he offered the best description or the best answer to the question was asked. Why does cancer seem to be named after different parts of the body? It's not that. It's the fact that that's where the cancer occurred. I'm a prostate cancer survivor because my cancer occurred in the prostate. If it occurs in the breast, they call it breast cancer. If it occurs in the lungs, then it's lung cancer. If it occurs in the brain, then it's brain cancer. But it all starts at a very microscopic level. So it's undetectable. And you could have cancer for years, but it needs to get to a point where it's big enough, large enough that it could be detected on some type of screening exam. Once they do that, and then they'll do a biopsy to confirm that the tissue is cancer. Then they can come up with a treatment plan. The other thing, and Dr. Tony did a good explanation about this, is you will be treated on based upon where the cancer is, the type of cancer it is, how fast it appears to be growing. They will develop a plan specific to you based upon the nature of that cancer, because it's one disease, but it takes on many forms, not many shapes, but many forms. And so the treatment will be specific to the type of cancer that you have and how aggressive it appears to be moving forward.
Well, let me
If I can
ask.
just jump in and say a couple of things which go along with what Dr. Tony had talked about, and again, what I'm hearing from Ms. Hyatt in terms of what our organization does. Whenever a patient gets diagnosed with cancer, that level of stress immediately goes from whatever level to a level that is much higher in terms of their body. So if what Dr. Tony says that now this stress will prevent you from responding as well to the treatment as if you didn't have the stress. So when we look at that, we have to look at your organization as being touching on some very key points. And also, I think as we go, if I got to sort of look back even a bit further, for a disease that creates so much fear, and for a disease that is so prevalent that we don't really do things. We talk about prevention in a lot of ways about a lot of things, but as we begin to understand about what caused the cancer, what kind of environment that the cancer is aggressive in, it brings up the point that we need to begin to practice prevention in terms of helping people to learn how to deal with the things that are going on in their regular daily life, right, that will lean and put them at risk of developing cancer or not surviving it if they get it. And so those are, those are some very important things and some very good issues and comments that you guys brought up here that we need to make certain that our community understand and try to figure out how they too can better prepare themselves, because again, they're going to be, when you're in with cancer, you're in for somewhat of a fight, and so you need to be prepared for a fight without the fight causing you to become weaker than what you would need to be.
Well, and I think, Nikki, you brought up a really good point, because I didn't refer to the prescription plan as cap and smooth. And I should have, because that's just a very easy way to describe it. So when it comes to messaging, we're talking to a universe of people. And how do you find the right message that everyone hears? Well, you can't. So that's where being in different audiences and figuring out the message that needs to get to a particular group of people is so key. Oftentimes people will say, well, I told somebody this 3 times and they just don't get it. Well, that's not really the case. Sometimes we just don't hear because we don't like to hear what we're hearing, right? So if we can figure out what the objectives are and the barriers, then we can hopefully make more inroads, right?
Yeah, I agree with everything my colleague said. And just to kind of round it off, the levels that Dr. Hampton mentioned, the cortisol levels, is that thing that's your stress hormone. And that's the thing that inhibits your immune system. It also causes surges in your blood sugar. It also inhibits your body's ability to deal with the what we call metastatic load. And so to the extent that Gilda's House or any other resource can reduce the amount of stress that your patients or that your family member is dealing with, by going to visit them, saying prayers with them, meditating, anything you do to reduce stress, you reduce cortisol levels. And then cortisol is that hormone. It is a protective hormone, but it also, over a longer time period, can become more destructive and not so helpful to your body.
So what's interesting is we also have a tool when somebody joins the club. It's called a cancer support source. It's a distress screening tool, and it's a self-reported tool. So when somebody comes to us for the first time, they'll say, well, this is where my stress is coming from. This is where my stress is coming from. And we'll say, well, here are programs that will help you. Here are resources that will help you. And when we test them 6 months later, almost 100% have seen a decrease in their stress levels. So it's very real. We had somebody once talk about the program that we do in the hospitals as being art on a cart. Well, art therapy is a wonderful tool to get people expressing themselves, especially when they're in infusion or they're getting a stem cell transplant and they're totally isolated. And when our art therapist comes in and works with them, it's life-changing.
Yeah,
Well,
I want to.
to me that many of the funerals that I've attended recently, people have gone out with pancreatic cancer. And the one I'm going to on Thursday, same cause. Yeah, why is pancreatic cancer so lethal?
So part of the problem is where it's located. It's deep in the body and it grows very quickly without symptoms. So that by the time you begin to have symptoms, it's very far advanced. And in that particular region of the body, it's not in a shell or a capsule. So that entire surgical field is very hard to remove surgically. And it's so large, it's hard to treat with radiation therapy. I guess the final part about this is it tends to be relatively resistant to chemotherapy too. So it's just unfortunately one of the very bad actors that we have in medicine. And it also depends on location. If it's at the very end of the pancreas, it's worse than if it's at the very head of the pancreas, where it causes symptoms earlier. And those are the ones that are more likely to be salvaged than the ones that have the disease at the very back end of the pancreas, where it tends to grow bigger and bigger until it's too late.
Dr. Pete, you used a term that I'd like for you to define. I see he's frozen, but hopefully he's not. And you talked about allostatic load, which I've read about. And allostatic load, and there's a lot of research that shows that African Americans tend to have a higher allostatic load. And that really speaks to the amount of stress that a person experiences on a day to day basis. And there's a quote that I was reminded of, and I think it was an artist, I can't remember his name. And it goes simply like this: any idiot can face a crisis. It's the day to day living that wears you out. And that's what we're talking about. Some people have more stress upon them than others. A lot of it has to do with where they live and the conditions they live in are unbelievably stressful. If you live in what they call a socioeconomically depressed area uh, with a high homicide rate, high crime rate, every day you get up, you have stressors that other people don't. So Dr. Pete, could you talk a little bit more about allostatic load and its impact relative to cancer and maybe other diseases?
Hello, hello, hello. Can you
Yeah,
hear me?
we hear you. We hear you. Go ahead, brother.
Okay, great. Okay, so allostatic load, Joey, I think you did a great job of um, summarizing that definition. It is the cumulative effects of chronic stress, and it's both physiologic stress and psychological stress. So, to your point, if you think about the social determinants of health, a lot of our patients in our communities are dealing with so much, right? Even prior to the diagnosis of cancer, just in terms of their childhood, they may have been abused, they may have grew up in a very impoverished situation, and then to add to that, they will come down with a diagnosis of cancer. And then you wonder why the immune system isn't responding quite as well to chemo. They have a lot of comorbid conditions like diabetes and high blood pressure and heart disease. And that's on top of the diagnosis of cancer. So that's the allostatic load is responsible for that. And that is the cumulative effect of all of the stress that you've been through your entire life. So now we wonder when that patient is not as responsive to normal chemotherapy agents or normal interventions that patients should be more responsive to. But great point, Joe.
And I think about it's kind of a interesting thing to consider when you work at a clinic or a hospital and you're a doctor, right? And there's this gap between what a doctor makes and what the people they work with make, right? And a lot of times, I think about my situation. Many of the people I work with are young moms. Let's just use a medical assistant as an example, right? So imagine that young mom having to think about childcare every day, all day. And oh, by the way, we have clinics that have late hours. Oh, by the way, who's going to take care of the baby when the last patient scheduled at 7 or 6:30 at night, right? That's a stress that's not going to go away because it's always there. Or the doctor's running behind. Have you ever been in a clinic where the doctor's running behind? I've never seen such a thing. So now the doctor's like, I'm just trying to take care of the patient. None of us is like, you need to hurry up so I can get home to my babies, right? So I won't have to pay that fee for being late to pick, or have a family member that's upset because I'm picking up my child late. And although they try to be sympathetic, so, oh, by the way, it's hard to pay the bills because I'm not making what the doctor's making. So these are just, if you just think about the people in your community that you work with, the person at the grocery store, the person, not the person outside the grocery store that's asking for some change. I'm talking about the person that's working inside that's struggling. I remember a time when this was a few years ago. I'm not sure how true it is now because the incomes have gone up a little bit. But I remember where there was a large percentage of the people that work at Walmart, they were still getting public assistance. medical assistants still getting, you know, they're still literally relying on the system to make ends meet. So imagine a young person having this chronic stress. Let's not talk about the fathers may or may not be at home. So I think that so then, as Brother Pete has suggested, of course people are gonna not respond to chemo as well. Of course, the chances of them listening to the metabolic health doc and following a dietary plan is going to be less. They have other priorities. So that's why we need Laura and her organization to at least grab some of these people by the arms, hold on to them and give them a resource. And we need to live in a world where we spend more money on this without being political. Imagine if we took $1,000 from the cost of Ozempic and we just put that towards these resources. What would $1,000 a month do for a person who's struggling? Just think about that for a second. Where are we spending our money anyway? We are really in a conundrum where we're spending a lot of money for the things that give little return on investment, and the things that we could do in this community to impact our families. It will be like that butterfly effect. It would affect beyond just that mom who's struggling. Her babies will be impacted. The people helping to take care of them would be impacted. How she works at the clinic would be impacted. All of these things would happen if we just put our resources in the right place. Now, how do we change that? That's going to be the question we'll all have to figure out. But that's the world we want to live in.
To the polls, we got to go vote.
You better say it again.
You got to go vote this time.
That's right. Yeah, we really do. We want to vote for people who really are, at the minimum, making the effort to move us in this direction. And people who don't care about us and are, kind of loyal to people who have things already, that's not going to really serve us. And I really want to live in that kind of world.
All right, Tony, you have just, first of all, Doug is about to bust. Doug's whole face has turned red because he has something he wants to say. But Doug, right before you speak, want to say hey to Yolanda Williams is here. Kimberly Alexander Jackson is here. And Kimberly says, I hate cancer. Cancer sucks. Bonnie Smedley is here. Sister Bonnie is here. I want to say hey to her. Nadine Dykes is here. Crystal Henderson is here. Melinda Maxwell is here. Elaine Phillips is here. Arlene Spencer is here. Miss Deborah from Coleman's is here, and she says, I'm listening. Sonia Blakely is here. Hey, my WBON sister, how are you? So now, Doug, go ahead.
So, Tony, that study does exist and was published this month in JAMA. And someone did a very elegantly designed study about giving people a certain amount of money every month, and beautifully showed that money was on healthcare and reduce their healthcare costs and improve their quality of life. So that study now exists, and the statistics are incredibly intricate and well defined.
Yeah, that's called universal basic income.
Spread that information.
Universal basic income. There's been a lot of talk about that.
Yeah.
Making sure that everybody has, it won't level the playing field, but at least everybody has enough to take care of some of the basics that they cannot afford to take care of.
That's right.
That's what some people say reparations is about.
I don't know if I can be heard. I don't know if you can even see me.
We got you, brother. We hear you.
Yes, we can hear you.
Yeah,
Move the camera down a little bit.
It's got. Yeah.
Is that better?
Yeah, a little bit.
We can see your eyes now, so we're getting close.
A little bit more. Is that better?
Yeah.
There we go.
Okay.
That works.
I don't want to take long. I just, being an old guy in the room here today, I'm reminded of the days when we first started doing diagnosing these particular cancers. And these were usually very bad cancers because they were always found late. And the treatment was always horrific. To do a pancreatoduodenectomy, that is, take out the pancreas, the duodenum, and a bunch of things. And then we found out that when we did that, what happened was patients couldn't eat because most of the digestive system wasn't working there anymore. And that was the development of parenteral nutrition, hyperalimentation, as we call it now. And so I say this only to say that there's been some good things that have come out of this tragedy, that we are able to do better than we used to do. And we have better modalities to try and detect these things a bit earlier and hopefully be able to do a bit more for people. Because when I was a resident at Mercy Hospital in general surgery, these were really the worst of the worst at that time. So I'm grateful that we've been able to do what we've been able to do, and I'm grateful for the information that we've been talking about here from Gilda's Club that really helps the other part. And you need that because that is such a bad, bad tumor that you need this all the support. And I'm grateful for what you guys are doing.
Yeah, I like to just sort of jump in and say one other thing. Being realistic, we're not going to make the economics in such a way that everybody is on a level that they can take care of themselves, that they can supply the needs for themselves, their families, as they desire. That's the likelihood of that's happening is not very high. But stress and all these kinds of things are dealt with in different kinds of ways. And when I say that, I'm saying that I think that there's some other things that we need to do as people, as community, as a city, as a state, as a country. And that is that we got to, this element of loving and caring for our fellow man, loving each other, being concerned for one another. We have to figure out how we can do that better. We're not doing a good job at that. It seems like to somehow uh, the pendulum is swinging farther away from where it should be, and we need to reverse that process. Because even though we might not be able to pay somebody's rent or pay for their kids' education, if we can sort of help to support them, help to take care of them mentally and spiritually, and to address and have just a discussion so that now they feel good about who they are, not because of a feeling that I'm not as good because I can't keep up. And those are things that money, love is not, money can't buy that. And not that we don't want these economic conditions to be better, but realistically, it's not going to get to what it ought to be. So I think that we have to figure out what we can do that is realistic in terms of helping our sisters and brothers in our community to deal with stress and to be able to make this, to travel this journey that's a rough journey, rough ride, and they need a helping hand. And sometimes that helping hand is just a whole lot of hand and just say, I love you, I care about you, and to be real. Because again, I can give somebody $100 and not really care about them. It doesn't have the same effect of that loving and caring, because that has a much more lasting effect. And so I think as a society, we have to figure out how we can better handle that.
Well, and if I could just offer an observation, right? It's like there's a difference between a transaction and a relationship. And I think sometimes giving people money has been viewed as the be all and end all, but without the support and without the caring community behind there, it's just a transaction. And if anything, that money certainly helps, but you failed in making that person see they're part of a larger ecosystem that sees them and cares about them.
I just want to quickly say that there's a difference between caring for somebody and really caring for somebody. I mean, there is, to your point, your poor Greg, having lived with a parent who ended up dying from a cancer, actually, as I was in medical school, and understanding the different stages that people sort of go through. For her, it was very difficult because there were certain things as a boy or man she didn't want me to do because of the nature of the disease and where she had cervical cancer. And so there were things that she just didn't, in order to keep her own dignity, she wanted to still be able to do something to help if she even couldn't do it for herself. And I say that only because just because people are in this bad way, they tried, and we kept telling them, don't give up, but you're not spending 30 seconds in their shoes. And you need to really understand that when you feel bad, you feel bad. And sometimes you're going to feel worse than in other days. And so we have to be able to, other points made by other people on the panel, to be able to look at it. And that's why I'm so glad to see the kinds of other things that are going on, because as doctors, we medicalize this a lot, but we, to your point, Tony, the human story is far, far different. And, and not only that, but sometimes the caregivers themselves, particularly when they're families, members of the family, and you're having to help with toileting needs and stuff of like that. You might be a little embarrassed, but the parent themselves may be more embarrassed than you.
Mhm.
And trying to figure out how they manage that and keep that distance as I'm the parent, you're the child, is difficult. And I don't want to go on and on because I get very emotional about this, because when you live it, it's a different experience. It's a very different experience. And so I put my hand out there and up for everybody who's trying to help. Money does help, because sometimes you just need money to help pay for the people to come in and take care of you a little bit when you're not able to. You still got to go to work. You still got to do other things. And we're not in a society that really cares much about that or looks at that deeply.
Mhm.
Pete, I can see.
Yeah, I want to add something to what you just said and pick up on what Dr. Miller said too, and Dr. Tony will really appreciate this. I saw this ad in the 80s. It was really Advocate to put it out. It was a full page ad. I can't remember what paper it is in, and it spoke to what the most important piece of medical equipment that their physicians have. Can anybody guess what it was?
Art.
There's some. No, heart might be one, but it wasn't the heart. But that's a good guess. Anybody else want to take a guess? You're muted, Pete.
I was saying, Joe, you love to do this kind of stuff. You love to do this.
But it was amazing. It was a picture of the human ear listening. That's the most important piece we have. Listening to each other. I'm just picking up on what Dr. Miller said. If you're not listening to people and hearing what they're saying and how they're feeling, how can you treat them? You're just looking at their symptoms. You're treating symptoms and waiting for the next person to come in the room. The only way to truly be a compassionate physician, nurse, or any healthcare provider is to be able to open up and listen to what the patients are saying. And I know that it's difficult because we have a healthcare system that is driven really by finances and money. And I know that there's coding for medical visits, and they're only supposed to last. You get a certain amount of money based upon the time it lasts, and you don't want to spend too much time talking to the patients and answering a lot of involved questions because on some reasons you're on the clock. But the most really one of the most important pieces of technical equipment that we have is the human ear and the ability to listen to other people and each other.
Well, have you heard that joke? Do you know why God gave us two ears and one mouth?
Mm-hmm.
We're supposed to use this twice as much as we use this.
That's right.
I don't know where we go from here because we've lost Nikki and she put you in charge, Pete.
All right. Okay. So I know people don't want to hear this, but it's about that time. I mean, it's about that time, and until next Monday, we just want to go around and let everyone just tell us until next Monday. And Joe, we're gonna go ahead and start with you until next Monday.
Well, I gave this some thought, so I'm prepared, and I'm gonna start with a rhetorical question. If I go to my doctor, and my doctor tells me I need to lose 10 pounds,
Yes.
he's telling me something I already know. Everybody knows how much they weigh. They know if they're overweight or not. That's no surprise when the doctor tells them they need to lose. They know that already. I'm saying that to make the point. Knowledge is power, but only if you use it and apply it.
I love it. I love it. That knowledge is power, but we have to use it and apply it. I love that. That's something great to think about until next Monday. Dr. James Miller, you want to give us until next Monday?
Yeah, I'm just going to continue on what I had said before. Compassion is one of the greatest things that we can give to others, is be compassionate and to show compassion towards each other.
That's awesome. Thank you so much, Dr. Miller. Dr. Graham, until next Monday.
Well, I want to tell you that Dr. Mason's story really resonated with me. I lost my mother to cancer in kind of very similar circumstances. Hers was very far advanced before it was discovered. And so I really applaud the work that Laura Jane is doing and how much it would have been of help if it were around at the time.
Thank you.
Thank you. Thank you so much, Dr. Graham. Dr. Mason, you want to share with us until next Monday?
Well, remember that no matter how sick somebody is, they still deserve the empathy that we should give them, and the support. And the fact that they can't do what they used to do is bothering them more than it's bothering you.
Yeah.
The fact they can't take care of themselves, they can't do their toileting needs, bothers them more than it bothers you. And
Yeah.
so we've got to strike that balance and understanding how you deal with that. And it takes a while. And we should never minimize what people are going through, saying that they'll get better sooner than we know that they will. And I'm not saying don't be positive, but I'm just saying don't be poisonous with your comments.
Thank you so much, Dr. Mason. And I appreciate that. Dr. Hampton, you want to tell us until next Monday?
I think we've all been exposed to the toxins that can increase our risk for cancer. I think about when I lived in Carroll Stream, and we were so excited to build these beautiful townhomes, which was our first house we built together. But in the background of those townhomes were, these power lines. So I don't know if I exposed my babies to something by living, not too far from power lines. But what I do know is that I can't control that now. What I can control is the future. So for everybody checking us out tonight, I want you to think about your life. Think about your, going back to rest. Are you getting enough sleep? If you can work one job instead of two jobs, please work one job. Are you in a stressful environment? Is there a way for you to improve or change that environment? Is your relationship, boyfriend, girlfriend, husband, wife, is it not healthy? And if so, are you courageous enough to talk to somebody about that? Are you eating fast food every day and you're not actually taking the moment to invest in a $75 air fryer that may change how you eat, right? So, that doesn't take a lot of time. So think about all the things that you can control and work towards controlling those things. And if you do that, you will greatly reduce your risk for cancer. And if you have somebody in your life who has cancer, who's at risk for cancer, just support them. Don't try to control things you can't. You're not the doctor. You're not the pharmaceutical. Your job is to be there as a friend, family member, and support them in the best way you know possible.
Thank you so much, Dr. Hampton. Just really quickly, I just want to give until next Monday, and then we're going to hand it over to Laura. Just in terms of if patients think that you might be at risk for cancer, there are screening tests that we have, not for all cancers, but for more common cancers. Ask your doctor, your primary doctor, at what age should you receive these screening tests. Then know that these are just tests, because some patients and some community people will believe that there's some therapeutic value in going to get a prostate test, some therapeutic value in going to get a mammogram. No, There's therapeutic value in what kind of life you live. So eating a low fat, high fiber diet, exercising, eating less food, period, having a positive, less stressful relationships. Those things are therapeutic things that you can do. Should you also go get your mammogram? Yes. Should you also go get your colonoscopy? Yes. But I try to remind my patients that there's no therapeutic value in this. So sure, your PSA is great. Now, what are you going to do now? Now that your PSA is below 4 and you think you're living oh yeah, everybody in there high fiving each other. No, let's high five and stop eating the kind of foods that we're eating that promotes a cancer loving environment. We want to produce an environment for cancer that cancer hates, right? High fiber, low fat, low sugar, right? So anyway, I just want to acknowledge that sometimes people believe that going to get these tests, which are good, but that won't keep you from having cancer. It's things that you will do and you will expose yourself to that will. And with that, Laura, you want to give us until next Monday?
Sure. I have learned over the years the difference between intent and impact, right? So I have always been a person of good intentions, but I haven't always thought through potential impact could be. So um, I have become hopefully much better at that because the intention is really about me wanting to do the right thing and be a good person. And I think it's kind of similar to what we've been talking about. The impact is what matters. If the intentions are good, then we really need to give equal consideration to the impact. I just finished a book. I don't know if anyone's heard about. It's a true story, The Best Minds. It's about two men. One developed schizophrenia, and the subtitle of the book is "The Tragedy of Good Intentions."
Mm, that is awesome. Thank you so much, Laura. Thank you for sharing about Gilda's house. I think our audience really enjoyed that and got a lot out of that.
Thank
Um,
you.
thank you. Thank you for coming. Please come back.
Oh,
And okay, go ahead. Look, Ms. Hyde.
oh, I said anytime. Sorry.
Awesome. Awesome. And now we have our congressman. Congressman, take us on home.
Well, let me tell you, I was thinking of some of all the many people that I know from a personal vantage point who could really benefit from these discussions because it reinforces for you how complex health is, how greatly needed medicine is, and how useful introspection is. That is when you look at yourself. I'm sitting here saying, I ain't gonna let Trump and them stress me out and move out of here. Or move me out of here soon. I'm not going to allow my staff to stress me out and cause me to leave out of here before I have to. And so everything sort of begins with self, no matter how it's impacted by everything else. And that even though all of the outside influences have impact on your being, the real deal is the outcome is going to depend a great deal on you, whoever you are, wherever you are. You have to be the captain. And so I just thank all of you. And I thank my Alpha brothers who, because I'm sure they remembered when they were pledging and all of that. And they had to say at some point, out of the night that covers me, black is the pit from pole to pole. I think what God's there would be for my unconquerable soul. Beyond this place of wrath and tears looms but the horror of the shade. And yet the menace of the years finds and shall find me unafraid. It matters not how straight the gate, how charged with punishment the scroll. For I am the master of my fate. I am the captain of my soul. And so, whoever we are, no matter what colors you fly, you gotta be the captain of your soul. So, ladies and gentlemen, thank you for a wonderful evening. And until next month, next Monday, keep on pushing. See?
Thank you.
All right.
Good night.
Good night.
Long. Good night.
Good night.